Hello everyone, in this video we will discuss some other points about the parotid gland. Here you can see the parotid duct emerging from the anterior border of the parotid gland. It is formed by the union of two vertical ducts close to its posterior border, and this parotid duct is about 5 centimeters long. It passes over the surface of the masseter, taking an additional small duct from the accessory parotid if present. At the anterior border of the masseter, it makes an inward bend and it pierces the buccinator muscle. So, on the buccinator muscle, you have the buccopharyngeal fascia. So, in piercing the buccinator, it will also pierce the buccopharyngeal fascia, and then deep to the buccinator, it will pass between the mucous membrane of the mouth and the buccinator muscle. So, there it lies in a submucous tunnel for a little bit of its course, and finally it opens into the vestibule of the mouth opposite the crown of the upper second molar tooth in an elevation which is called the parotid papilla. Now if you take a look over here, you can still see the outline of the parotid duct. You can see the parotid duct here with the accessory parotid gland and duct, and in this picture you can see it even better. Here is the parotid duct taking a right angle bend at the anterior margin of the masseter, piercing the buccinator and opening in the vestibule of the mouth opposite the crown of the upper second molar tooth on an elevation which is called the parotid papilla. So in this diagram, this is the first molar. Somewhere here would have been the second molar. So just outside this second molar over here, in the vestibule of the mouth, you have the opening of the parotid duct. And now we are going to study some other features. Within the substance of the parotid gland, you have three major structures, the most superficial of them being the facial nerve. So this facial nerve enters the posteromedial surface of the parotid after emerging from the stylomastoid foramen, and it immediately divides into a temporofacial and a cervicofacial trunks. So from this temporofacial trunk you have the temporal branch, the zygomatic branch. From the cervicofacial trunk you have the upper buccal, the lower buccal, the marginal mandibular and the cervical branch. Now this plane of the facial nerve divides the substance of the parotid gland into a superficial part and a deep part, and this arrangement is also called the parotid sandwich. Deep to the facial nerve you have the venous plane, that is, you have the plane of formation of the retromandibular vein by the union of the superficial temporal and maxillary veins, and this retromandibular vein splits into anterior division and posterior division, and the anterior division joins with the facial vein to form the common facial vein draining into internal jugular vein, and the posterior division joins with the posterior auricular vein to form the external jugular vein draining into the subclavian vein. So this is the second deepest structure, and the most deep structure is the external carotid artery, which has again entered the parotid gland from its posteromedial surface, and behind the neck of the mandible it has terminated as maxillary artery going deep to the mandible and superficial temporal artery going upwards in front of the ear, accompanied by the auriculotemporal nerve. So these are the structures within the parotid gland, and the superficial temporal artery along with its branches, as well as the posterior auricular artery, which is another important branch of the external carotid given within the parotid gland. These are forming the arterial and venous supply of the parotid gland. This facial nerve, however, is not meant for the parotid gland. Rather, the nerve supply of the parotid gland comes from the auriculotemporal nerve, which will emerge from behind the neck of the mandible from a deeper plane. Deep to the neck of the mandible, you have the mandibular nerve and the otic ganglion, and from the mandibular nerve, you have the auriculotemporal nerve peeping up from behind the neck of the mandible, curling behind to supply the secretomotor parasympathetic fibers to the parotid gland and rising up to accompany the superficial temporal vessels and going up into the vault of the skull to supply the part of the scalp as well. Now the nerve supply of this parotid gland, it comes immediately from the auriculotemporal nerve, but this auriculotemporal nerve, although it is a branch of the mandibular nerve, it actually is carrying fibers of the glossopharyngeal nerve. So the secretomotor fibers to the parotid gland come from the glossopharyngeal nerve via the auriculotemporal nerve, whereas the sympathetic fibers come from a nerve net around the external carotid artery. The external and internal carotid arteries both have a sympathetic nerve net on them. But then let us look at this glossopharyngeal nerve supply. See, here we have in this picture, here you can make out the glossopharyngeal nerve coming from the brain stem, and this glossopharyngeal nerve, after exiting the brain and supplying other structures both in the pharynx and in the tongue, it gives off a small branch just below the base of the skull, that is called the tympanic branch of the glossopharyngeal. And this tympanic branch rises up, enters the petrous part of the temporal bone and forms a plexus on the wall of the middle ear, which is called the tympanic plexus. From the tympanic plexus you have the exit of a nerve called the lesser superficial petrosal nerve. This nerve comes out from the petrous part of the temporal bone and goes on medial to the neck of the mandible to relay in the otic ganglion. From the otic ganglion, postganglionic fibers leave the glossopharyngeal nerve and piggyback onto this branch from the mandibular nerve. Here from the trigeminal nerve you can see ophthalmic, maxillary and mandibular. And beyond the otic ganglion, these fibers originally from the glossopharyngeal nerve have piggybacked on this branch of the mandibular nerve, which is called the auriculotemporal nerve, this split nerve. And this auriculotemporal nerve emerges behind the neck of the mandible, enters the parotid gland and supplies the parotid gland with secretomotor fibers. And again you can make out this sympathetic nerve net around the internal carotid artery. A similar nerve net exists over the external carotid artery, which again terminates inside the parotid gland. So this is the mechanism of the nerve supply of the parotid gland. Apart from this, if you think about the lymphatics of the parotid gland has got superficial lymphatics on the parotidomasseteric fascia and superficial lymph nodes, and it has got a deep set of lymph nodes within the substance of the parotid gland itself. Efferents from these lymph nodes drain into the upper group of deep cervical lymph nodes just below the posterior belly of the digastric, and these lymph nodes are also called the jugulo-digastric lymph nodes. So now more or less we have completed a discussion of the parotid gland, and we are going to discuss in the next video some applied aspects.